Hi, this is Ahmed Ajeene, a senior medical student at Jordan University of Science and Technology, and in this small lecture we will talk about diabetic foot infections. Now, diabetic patients are at high risk of developing infections anywhere in their body, and specifically if they have a diabetic foot condition, it's more or they are more prone of developing infections in their feet. Now, these infections have a high morbidity and mortality rates and may increase the risk of amputation in these individuals. Now, risk factors of diabetic foot infections include three main things. The first one is a neuropathy. Now, a neuropathy is defined as a damage or dysfunction of one or more nerves that typically results in numbness, tingling, muscle weakness, and pain in the affected area. Now, neuropathy have three main types. The first type of neuropathy is sensory neuropathy, which is a diminished perception of pain and temperature. So these patients with sensory neuropathy are more prone to have a slow recognition of the presence of injury in their feet. Now, the second type of neuropathy is autonomic neuropathy. Now, we all know that autonomic nervous system supplies sweat glands, and if you have a diminished autonomic nervous system, that means you have a diminished sweat secretion. Now, these diminished sweat secretions may cause dry, cracked skin, and this type of skin is more prone to have a bacterial infection. Now, the last type of neuropathy is motor neuropathy, which can cause foot deformities, and these foot deformities causes pressure-induced soft tissue damage. Now, the next risk factor of developing diabetic foot infections is peripheral vascular disease. We all know that blood is very important because it contains immune cells that help in the fighting of infections. Now, if you have a peripheral vascular disease, this means that you have impaired blood flow necessary for healing ulcers and infections. So, this risk factor causes or leads to an increased infections. Now, the last risk factor of developing diabetic foot infections is poor glycemic control, or let's say hyperglycemia. Now, we all know that hyperglycemia can severely affect the immune system and cause the patients to be immunocompromised. Now, hyperglycemia specifically impairs neutrophil function and causes a reduction in the host defenses. So, hyperglycemia can cause or can make an individual more prone to developing infections. Now, most diabetic infections are described to be polymicrobial. The word polymicrobial means that we have more than one microorganism causing an infection in a diabetic foot. Now, the number of microorganisms causing these infections may reach up to 5 or 7 different specific organisms. Now, the types of microorganisms causing an infection can vary depending on the extent of the involvement. For example, superficial diabetic foot infections like cellulitis are mainly caused by aerobic gram-positive cocci, which includes Staphylococcus aureus, Streptococcus agalacti, Streptococcus pyogenes, and coagulase-negative staphylococci. Next are deep ulcers that are chronically infected or have been previously treated with antibiotics. These types of ulcers are also polymicrobial. They may be caused by one of the aforementioned microorganisms, plus they may be caused by enterococci, enterobacteriaceae, Pseudomonas aeruginosa, and anaerobes. Finally, wounds with extensive local inflammation, necrosis, malodorous drainage, or gangrene, these types of wounds must be presumed to be caused by anaerobic organisms. Also, it may be caused by one of the aforementioned microorganisms. Finally, it's worth mentioning that the microorganisms causing these infections depend on the geographic location. This means that gram-negative pathogens are mainly cause infections in the subtropical climates of Africa and Asia. In contrast, gram-positive microorganisms are more commonly to cause infections in the Western Hemisphere.